Affirming care for LGBTQIA+, older adults in adult care facilities, skilled nursing facilities, community-based long-term care, and hospice. A guide for direct care workers. My name is Dr. Jen Moore, and I'm the Quality Assurance and Performance Improvement Coordinator in the Division of Residential Support, the Center for Residential Surveillance in the Office of Aging and Long-Term Care for the New York State Department of Health. This training is divided into 7 sections that are designed to provide information about the laws protecting members of the LGBTQIA+ community. The purpose of this training is to help prepare staff in these settings to practice affirming care for patients with diverse sexual orientations, gender identities, or expressions. LGBTQIA+ older adults do not always feel safe to be open about who they are because of the history and stigma of discrimination. Many came of an age and lived through many years in which this discrimination was condoned or even encouraged by society. Section 1. Goal Statements and Objectives. The goal of this program is that participants will demonstrate the ability to understand the laws that protect members of the LGBTQIA+ community in adult care facilities, skilled nursing facilities, community-based long-term care, and hospice. By the end of this module, learners will be able to explain terms related to gender identity and sexual orientation, including lesbian, gay, bisexual, queer, questioning, intersex, asexual, gender nonconforming, and non-binary. Learners will be able to describe common concerns of residents with diverse sexual orientations and gender identities in long-term care facilities. Learners will be able to describe the federal and New York State laws that protect this community. Also describe the importance of using affirming language when dealing with LGBTQIA+ older adults. Learners will learn to create communities welcoming to residents with diverse sexual orientations and gender identities or expressions, including older adults, their loved ones, and their caregivers. Lastly, learners will demonstrate the knowledge of best practices in providing affirming care to residents with diverse sexual orientations and gender identities or expression. There are a lot of terms associated with the LGBTQIA+ community. Becoming familiar with the key terms is an important way to show respect and communicate your support. The words you choose have an impact on the residents that you care for. So it's important that you find out what terms each resident is comfortable with you using. When in doubt, just ask. LGBTQIA+ stands for lesbian, gay, bisexual, transgender, queer, asexual, intersex, and plus. The plus represents other people that are not listed in the acronym but still identify as part of the community. Section 2. Federal and state laws. There are laws and regulations in place that prohibit discrimination against people based on their LGBTQIA+ or HIV status. These are important to ensuring the safety and well-being and equal treatment of LGBTQIA+ individuals in society. These legal protections send a powerful message that LGBTQIA+ persons deserve respect. As a direct care provider for LGBTQIA+ older adults, you should be aware of these laws, their protections, and the rights that your residents have. Some of the federal laws that protect members of the LGBTQIA+ community include Title IV of the Civil Rights Act of 1964, the Affordable Care Act in Section 1557, the Housing and Urban Development Equal Access Rule, the Fair Housing Act, and the Nursing Home Reform Act. There are also New York State laws that protect members of the LGBTQIA+ community. They are the New York State Human Rights Law, Chapter 81 of the Laws of 2023, and most importantly for today's presentation, the New York State LGBTQ+ Long-Term Care Bill of Rights. This is an act ensuring that the LGBTQIA+ people and people living with HIV in long-term care communities receive equitable and fair treatment. All facility staff that have direct care with residents of these facilities must receive training every 2 years and within every 6 months of hire. In addition, a poster has to be visible in all facilities that provides the following information. This is the information that is required to be posted and visible. The name of the facility begins the presentation and continues that it does not discriminate and does not permit discrimination, including but not limited to bullying, abuse, harassment, or differential treatment on the basis of actual or perceived sexual orientation, gender identity or expression, or HIV status, or based on association with another individual on account of that individual actual or perceived sexual orientation, gender identity or expression, or HIV status. You may file a complaint with the Office of New York State Long-Term Care Ombudsman Program. That's where you would place your contact information if you believe you have experienced this kind of discrimination. Let's review some case studies. Reminder, this training is based on the November 30th, 2023 legislation, where New York State Governor Kathy Hochul signed into law a bill which establishes this Bill of Rights to protect long-term care facility residents who are lesbian, gay, bisexual, transgender, or living with HIV. As a result of this bill, long-term care facilities and their staff may not discriminate against any resident because of their actual or perceived sexual orientation, gender identity or expression, or HIV status. The following scenarios will help you to explore how you can be an important ally to help prevent discrimination and assist LGBTQIA+ older adults in getting the care that they need. Michael and Gary have been happily married since 2011. When Gary was diagnosed with terminal cancer, he had to be moved to a long-term care facility. Michael spends most of his day in the facility with Gary, and Gary is reassured by Michael's presence. The two are often found holding hands or otherwise embracing or hugging each other. One day, you observe a colleague asking Mike and Gary to not be in the day room because they're making other residents uncomfortable. You overhear other facility staff making comments behind Michael's and Gary's back. Do they really need to hold hands in public? I mean, I don't care what they do in private, but why do they have to sit so close to each other and have their arms around each other all the time? How does the Bill of Rights protect Gary and Michael? Very simple. They cannot be discriminated against because of their actual or perceived sexual orientation, gender identity or expression, or HIV status. You then learn that staff are spreading rumors about Michael and Gary. How does the Bill of Rights protect Gary and Michael in this instance? Simple. Information about their sexual orientation and health status must be protected by facility staff. Michael then tells you he feels bullied by these comments, and he hears other people making public comments about gay people. How does the Bill of Rights protect Gary and Michael in this instance? Residents and staff may not bully, abuse, or harass them or treat them differently because of actual or perceived sexual orientation, identity, or expression, or HIV status. These men are allowed to be romantic with each other without fearing the consequences of their affection. Case Study 2. Jenny is a trans man living with HIV who has resided in his same home for 67 years. After a stroke, he is admitted to a rehabilitation facility. He discloses on admission that he has HIV. The staff member then informs him, "I don't think this is the right place for you. We've never had a resident with HIV. Wouldn't you prefer to go someplace else?" How does the Bill of Rights protect Jenny in this instance? Well, the staff's proposed solution singles Jenny out for having HIV, and if the rehab refuses to admit him, it violates the Bill of Rights as well as federal disability law and New York human rights laws. This employee may have had good intentions, but this is illegal. Jenny was then admitted to the facility, and later another resident on his floor tells the staff he knows Jenny is a trans man, but he is not comfortable being in the same men's room as Jenny. To ensure this resident feels comfortable, staff asked Jenny to use a single-stall restroom rather than the multi-stall bathroom. How does the Bill of Rights protect Jenny in this instance? Well, another resident's discomfort does not mean that Jenny's legal rights can be violated. Asking Jenny to use a separate restroom violates the Bill of Rights as well as state human rights laws. Jenny has the right to use that bathroom. Dino is a 50-year-old trans man who was in a very bad car accident. He was admitted to a long-term care facility after an extended stay in the hospital because he could no longer take care of himself. Dino has worn a breast binder for many years to keep his chest flat and hide his breasts. As a direct care worker, you have taken this training and you made Dino feel comfortable enough to ask for your help putting on his breast binder. A colleague overhears the conversation and eagerly says they will help you because they've never seen a breast binder before and they're curious. How should you respond? You should firmly decline your colleague's offer to help and explain that staff not directly involved in providing direct care to a resident should not be present with you or provide personal care services unless the resident chooses to have someone at the bedside and choose to give that authorization. The Bill of Rights protects Dino in this instance because long-term care facility staff not directly involved in providing care to a resident, including but not limited to a transgender or gender nonconforming resident, shall not be present during a physical examination or the provision of personal care, as in the case here, to such resident if such resident is partially or fully unclothed without express permission of such resident or such resident's legally authorized representative or responsible party. What are the key points from these case studies? Reminder, legal protections for LGBTQIA+ individuals are important for ensuring their safety, well-being, and equal treatment in society. These protections send a powerful message that LGBTQIA+ persons deserve respect. When members of the LGBTQIA+ community speak up for themselves and their rights are protected, it makes for a more inclusive and accepting environment for all. LGBTQIA+ older adults do not always feel safe to be open about who they are because of the history of stigma and discrimination. Many came of an age and lived through many years in which this discrimination was condoned or maybe even encouraged by society. Section 4, Common Assumptions. We all make assumptions all the time. However, as a direct care provider, it's important that you act on true information and not your own personal bias. Becoming aware of your assumptions, you can take a step back and practice being more open-minded. Engaging others in conversation and asking open-ended questions will help you better understand how your residents self-identify and that identity and means what that means to them. So what is an assumption? An assumption means that when we look at something, we accept that what it is just by looking at it. For example, this type is black and this type is red. It's important to be respectful and listen to the older adult and resident that you're dealing with. We can't assume that everyone thinks like we do. LGBTQIA+ older adults do not always feel safe to be open about who they are because of the history and stigma of discrimination. What are the most common assumptions? Well, here are 3. First one, I can tell by looking at someone if they're LGBTQIA+. For example, a man and a woman share a room together. You assume that they're heterosexual, when one of them both of them may be bisexual. This kind of assumption keeps the bisexual community invisible and may influence how you and others interact with the couple. A second assumption, don't ask and don't tell is the safest approach. Well, Alex, a new gender nonconforming resident, asks where the restroom is. You're uncertain, so you show them to the men's room. Alex frowns and walks away. This kind of assumption can unintentionally signal that it's unsafe for residents to disclose about themselves. Lastly, another very common assumption, older people are not having sex, so I don't need to know if they're part of the LGBTQIA+ community. For example, 2 men in your facility are often very close, but quickly separate when you approach and appear nervous. You assume that they're not intimate. This kind of assumption discourages residents from being open about their relationships and may reinforce stigmatizing behaviors of other residents and staff. Section 5, Language and terms. Let's begin with pronouns. Pronouns are words. They are words like he, his, she, her, they, their. They are an important part about how a person identifies. Using the correct pronouns helps to affirm their gender identity, create a safe space, and signal mutual respect. Misgendering or using the incorrect pronoun can make people feel disrespected, dismissed, and invalidated. Asking and correctly using the proper pronouns is a basic way to show respect. By sharing your pronouns, you indicate to others that you care about respecting the gender identities of all individuals. The words you choose have an impact on the people that you care for. It's important to review language and terms because it conveys openness and respect. It's important to also know that this language is always changing and evolving. The best thing to do when you're unsure about language and terms to use when talking to another person is just to ask the person. The language and terms may be different for each person based on things like how old they are or where they are from. Let's go through some of the most common language and terms used in the LGBTQIA+ community. Ally. An ally is a person who works for social change for a group of people. An ally is not a member of the group but supports them. Asexual. A sexual orientation is where someone may be attracted to others but does not have sex with anyone. Bisexual. Bisexual is an individual who is physically, romantically, and/or emotionally attracted to both men and women. Cisgender. Individuals whose gender identity or gender expression do align with the way that they were born. Coming out. Coming out is a lifelong process of self-acceptance of one's sexual or gender identity that may include a sharing of that identity with others. Discrimination. Discrimination is an unfair and unequal treatment in favor of or against an individual or group based on being identified as belonging to a certain group. Dyke. Dyke is a slang for lesbian. Feminist. A feminist is a person who fights for and defends equal rights for women. Gay. A word used to describe anyone, mainly men, who have primary physical, romantic, and/or emotional attraction to someone of the same sex. Gender. The socially decided behaviors, expectations, roles, clothing, grooming, values, and beliefs typically assigned to males or females. Gender-affirming surgery. Surgery performed to create private parts that reflect the sex of the person which a person identifies. Gender expression. How a person outwardly expresses their gender identity. Gender nonconforming. Describes people whose physical appearance or behaviors do not align with the societal expectations of their. Heterosexual. Heterosexual is used to describe people whose primary physical, romantic, and emotional attraction is to people of the opposite sex. This is known as being straight. HIV and AIDS. HIV is the human immunodeficiency virus. It's a virus that attacks the body's infection-fighting cells and can lead to AIDS, which is acquired immunodeficiency syndrome. Homophobia. Homophobia refers to a fear of lesbians and gay men. Homosexual, an outdated clinical or medical term that is no longer the best word used to describe why someone who is gay or lesbian. Hormone therapy. Use of hormone treatments to create characteristics that reflect the sex of which the person identifies. Intersex. Describes people who have biological traits of that do not fit the typical definition of male or female. These may be genetic, hormonal, or anatomical variations. Lesbian. A woman whose primary physical, romantic, and/or emotional attraction is to women. Important to note, LGBTQIA+ older adults is the preferred term for LGBTQIA+ people aged 65 and older. The term older adults may be preferable to old, senior, elderly, or aging. And depending on the context, also acceptable is the term older LGBTQIA+ people or LGBTQIA+ older people. Non-binary. Describes people who feel their identity is either male or female. Partner. A non-discriminatory and gender-neutral way to describe one of the people in a committed long-term relationship. Prejudice. Prejudice is a belief or judgment about a group of people or person based on things like race. It usually refers to negative beliefs, opinions, or judgments. Queer. Historically considered a negative term, queer is now being used by some LGBTQIA+ people to describe themselves. However, it's not universally accepted even within the LGBTQIA+ community and should be avoided unless quoting or describing someone who self-identifies in this way. Questioning, a person who is unsure about their sexual orientation or gender identity. Sexual orientation, a person's primary physical, romantic, and/or emotional attraction to members of the same or opposite sex. Transgender, an umbrella term for people whose gender identity or gender expression differs from the sex they were assigned at birth. Transition, the process of changing genders to match a person's gender the gender a person feels inside. And two-spirit, the term refers to LGBTQIA+ people and reflects traditions among many Native American nations that accept and celebrate the diversity of human gender, spirituality, and sexuality. Section 6, Best Practices for Working with LGBTQIA+ Adults. Some key points when working with LGBTQIA+ residents. LGBTQIA+ residents may not get the same health care as other people because they're afraid to talk about their concerns. When this happens, it is known as a health disparity. LGBTQIA+ residents deserve the same respect and quality services as everyone else. There are many personal reasons that someone isn't coming out about their sexual orientation or gender identity or HIV status. Service providers should not always assume they can identify any member of the LGBTQIA+ community. Many providers assume that every person who comes into their organization is heterosexual. Some also assume it's best not to discuss LGBTQIA topics unless someone asks. By not asking, healthcare and social service providers are promoting stigma, isolation, and often depression. Healthcare and social service providers may not realize that many of their older adults belong as a part of this community. Therefore, when they come in for services, they may not talk about their lives or because they fear being treated badly. All residents deserve support and acceptance about their sexual health. Remember, pronouns are words that matter. If you're not sure about someone's pronouns, just ask. All older adults deserve to be included in their healthcare and decision-making, and the Bill of Rights protects long-term care facility residents who are lesbian, gay, bisexual, transgender, or living with HIV. Aging brings life transition that can create opportunities for older adults to redefine what sexuality and intimacy might mean to them. It's important for these caregivers to learn best practices for care when working with this community, so they feel included, respected, and supported with dignity. So how can you do this? Begin by beginning a discussion about gender identity and sexual orientation. This can help demonstrate that it's safe to be open. In addition, acknowledge that these significant health and mental health disparities exist. When a caregiver does this, they can help address these disparities. What else do we know about health disparities for this community? We know specifically that there are higher rates of HIV and other sexually transmitted infections. We know there's lower rates of mammography and pap smear screening. We know there's higher rates of depression and anxiety, higher rates of substance abuse and smoking, higher rates of unhealthy weight control and perception of weight, and lastly, and unfortunately, higher rates of violence victimization. In conclusion, in one study, 82% of the LGBTQIA+ community reported experiencing at least one instance of victimization, such as threats, harassment, or even physical assault. In the same study, people reported delaying or even avoiding necessary medical care because they feared discrimination or mistreatment by the healthcare staff. 34% of the same group said they worry about having to hide their sexual identity in order to access senior housing. They also noted they would be more comfortable with long-term care services if they knew staff had been specifically trained about the needs of people with diverse sexual orientation and gender identities. It is important to note HIV disproportionately impacts the LGBTQIA+ community. 57% of New Yorkers living with HIV are now over the age of 50 years. In 28 In 2020, 28% of them reported experiencing a stigma related to their diagnosis. Most people who work with older adults don't intentionally discriminate against people in their care. Most often, they just simply have not been aware of the specific needs of older adults who are LGBTQIA+ or living with HIV. Perhaps people haven't thought about the impact of these practices and policies that people have on their care. So as a long-term care provider, you can engage the people you care for in a deep and meaningful way. This requires compassion and trust that is built over time. Some of the residents you care for may have faced painful moments in their lifetime because of their LGBTQIA+ identity or HIV status. In conclusion, here's how you can support the people you care for in living their fullest life possible. Avoid assumptions. Ask open-ended questions. Use inclusive language that reflects the language used by the people you care for. Support your residents' autonomy when providing personal care. Maintain privacy of the people you care for. And lastly, respect the Bill of Rights for long-term care residents who are LGBTQIA+ or living with HIV. Thank you. The Office of Aging and Long-Term Care focuses on the transformation of New York's aging, long-term care, and disability systems so that they remain financially and operationally sustainable. A key function of this office is the multi-agency collaborative Master Plan for Aging, as outlined here. The mission, vision, and value statement of the New York State Department of Health includes the mission to protect and promote health and well-being for all, building on a foundation of health equity. The vision is that New York is a healthy community of thriving individuals and families. And our values are public good, integrity, innovation, collaboration, excellence, respect, and inclusion. We define health as a state of optimal physical, mental, and social well-being. And our statement on health equity is that health equity is foundational to everything we do to help all people achieve optimal physical and mental and social well-being. Everyone at the Department of Health shares the responsibility for achieving health equity and eliminating health disparities. These are the references used in this presentation.